Thank you. It's a privilege to be here. Jaideep and myself joined Gopal and Ikram as founding members of the Health AI Institute. And in this couple of years, it has grown to become this think tank. As Gopal was saying, we have many-fold initiatives. Majority of them are around creating advocacy and policy around health AI. But we want you to be the flag bearers of how we develop this. So these next 2-3 days are all about listening to you, generating ideas. So as we have coffee breaks, lunch hours, please network, please talk among yourselves and give us ideas too, because we want this to be a collective and not just a think tank of a few people. With that, it's my pleasure to introduce our Fireside Chat keynote speaker, Bill Gassen. Bill is the president and CEO of Sanford Health, 11 billion integrated health system serving communities across the upper Midwest. Bill has been quoted by Modern Healthcare as the top 100 influential healthcare leaders for 3 years in a row. His passion is for driving rural healthcare, and he will be talking about how he sees AI intersecting when it comes to care delivery in the rural states. In 2024, Bill led Sanford Health through a historic transformation with opening of the new Sanford Health Virtual Care Center in Sioux Falls. This is part of that rethinking and reshaping of rural healthcare and using innovative technology in order to deliver better outcomes for our rural populations. Bill will be in a conversation here with Gopal Khanan in a fireside chat. They have some standard sort of canned questions about rural healthcare and where Bill's vision is going, but then we'll open it up to the audience. So start thinking about your questions, writing them down. And while we're on that topic, throughout this summit, we'll be putting up a QR code. We do want your feedback, so please scan that QR code to give us your candid feedback on the sessions as well. Thank you, and welcome Bill and Gopal.
Thank you very much.
Well, a hearty welcome and thank you to Bill before he even starts giving us all the wonderful ideas that people just talked about. So one more round of applause for Bill. Thank you. Bill, thank you so much for joining us.
Thank you. Thank you for the opportunity to be here. Thanks to the University of Minnesota for the opportunity to be here as well.
It's a great partnership and we're looking for some exciting work going ahead in the future. I want to come to rural health.
Yeah.
It's an area that is of enormous passion for me personally. I think so. We have a huge population base in the country, 20% plus
Right.
Americans live in rural America. I think there's always been a challenge in making sure that the care is delivered in a timely manner, given the workforce situation and challenges we have, as well as physical challenges. I would like to just talk through and then understand as to how, under your leadership, this whole mission was crystallized and developed into focusing on rural care at Sanford.
Yeah, again, thank you for the opportunity. It's a great opportunity to be able to talk about some of those challenges and opportunities that we face today in rural healthcare. And for us at Sanford Health, I had the opportunity and the privilege to step into this role about 5 years ago. And as we know in this country and around the world, especially from a healthcare perspective, we were at a pretty dynamic time as we were moving through and trying to maneuver through a worldwide pandemic. And for us at Sanford, it gave us a really unique opportunity to focus on what matters most and to be able to focus on what is it that we believe we can do uniquely in partnership with others in a way to really transform the patients and the communities that we have the privilege of serving. And so for us, it was a chance to really just sit back and reflect and say, who are we and who have we been for the last 125 years? And it became very, very clear that Sanford Health was put together by a combination of great physicians, great clinicians, great hospitals spread out over the upper Midwest, all coming together, coalescing around a mission to make sure that we could deliver world-class care to everybody, regardless of their zip code. And for us, those zip codes are largely rural communities. 2/3 of the over 2 million patients we serve today come to us from rural communities. And so it's really who we are, And it's really the expertise that we built out. And we believe very firmly that, but for us, nobody else would be in a position to serve those individuals. And we see it as a very unique calling to ensure that we deliver that world-class care to every single patient, regardless of their zip code.
Well, you talk about calling and this commitment to service. You have a very interesting background growing up all across the country, with your father being in the Air Force and
Correct.
Mother being in the healthcare. Tell us a little bit about you growing up and how that has shaped you as an individual.
Yeah.
And where you are today.
Absolutely. I think, like all of us, we're a product of sort of where we came from, what we were exposed to. And for me, I was really blessed to have grown up with two parents who were committed to service. My father, as you mentioned, enlisted during Vietnam and then served out 24 years of active duty in the United States Air Force. At the conclusion of his service in the Air Force, then he started what is South Dakota's largest hunger relief organization. And so throughout his nearly 50 years in the workforce before he became full-time grandfather, was really dedicated to service. It was dedicated to making sure that he got up every single day or stayed up all night to ensure that he was meeting the needs of people. And at the same time, and for those who have moved around, whether military service or otherwise, you know, for a partner or a spouse, it can be challenging to find work as you move all the time. I always said, having a father in the Air Force, I never heard the conversation around the dining room table that said, do we want to consider relocating? It was, I have orders and we're moving. Yeah. And so my mother also had a passion, a desire to serve, not only as the mother to me and my two brothers, but always had a desire to be able to to provide service, but needed a career that was portable. And for her, that career ended up being nursing. And raising three children with a father who was traveling a lot in the military, she committed herself to serving as an inpatient RN and working straight nights throughout the vast majority of her career. And so I, like many of our families and our caregivers, grew up with a mother who would make sure that dinner was done, made sure that we had homework either in motion or done, and then I'd watch her put on her scrubs and head out the door to then work all through the evening, and then be there in the morning before we left for school. And so that was really my first exposure to really understanding healthcare and at that direct patient care level. And my mother today, after 40 years of nursing, would say the same thing, that there's advancements of technology, there's changes, much happened over the 40 years that she served. But at the end of the day, it starts and it ends with that patient. And you said that earlier, it is a people-centric calling. And I believe technology is going to unlock great opportunities for us to continue to transform that. But I'm reminded of something that I share often with our organization, and that is that what we do, and at Sanford Health, that is to care, comfort, and cure, will never change. How we do it has to change.
Mm-hmm. So you talked about technology a little bit over here, and AI, that's the talk of the town, the talk of the country, of the world. How do you see that in rural healthcare setting, helping you achieve better outcomes that we all aspire for? What's some of your thinking around AI and the new wave of technologies?
Yeah, I would say technology, the digital transformation, AI, generative AI, these are the most powerful tools we have to be able to transform what we do. And for us serving rural America, we see our chief challenges are access, quality, and sustainability. And I believe that the number one weapon we have in combating those challenges is technology, and very specifically, as we talk about here, those advancements with AI and generative AI. And for us, it's being able to address a number of the things that you've already referenced here today. And this isn't unique to rural America, but it's of course the lens that we bring to the table. But you have challenges from a workforce perspective as you seek to ensure that every single community has access to the right care at the right time. Be able to make sure that we can bring specialists and subspecialists there to the right people at the right time. And to, again, make sure that it's not just almost or just enough care, but it is the highest quality care. Because we believe that every patient, irrespective of their zip code, deserves that here in this country. And in order for us to be able to do that, there's only so much you can do with planes, trains, and automobiles. And we've been deploying for over 100 years, incredibly talented and committed providers who say, I will drive 400 miles to go meet that patient. But that has a rate limiting step. And so for us, one of the ways that we've been helping to close those access gaps across rural America, across the Dakotas, western Minnesota, Wisconsin, the Upper Peninsula of Michigan, Wyoming, has really been to be able to deploy virtual care. And that virtual care becomes increasingly more advanced now that we add in the advancements with AI and generative AI. But very specifically, we started off a few years ago and we had one or two different lines of care that we were able to provide. Primary care, be able to provide some women's and children's care. But now today, we're pleased to be able to offer 78 specialties through virtual care. And we're able to provide those across all the communities that we serve today. And in particular, we've really tried to think about not just how we provide that care, but as was referenced earlier, with the opportunity and the advent of our virtual care center, it's allowing us to not only provide that care, but it creates a unique opportunity for us to train those clinicians in the future as well too. And so leveraging all of those technologies helps us close those access gaps. It also helps us do it in a way that's more affordable. You know, so often right now we think about the challenges within the healthcare ecosystem and the challenges of the field. It's around costs. And I don't want to diminish those conversations, but a lot of times what gets left out, especially in rural America, those indirect costs. That when you have a patient or a patient's family that has to travel hundreds of miles to be able to have an encounter with a provider, that oftentimes becomes the barrier to care. That person may not have the ability to take time off work. They may not have access to reliable transportation. They may not have access to care for their children in their absence. And then all the other related costs, hotels and the others. And so for us, we've found that for every one of our virtual encounters on average, it saves us 176 miles round trip. That's saving those individuals significant dollars, but much more importantly, it's ensuring that we don't have delayed, deferred, or void care. And we know that getting upstream is going to be critically important for those individuals.
So you've introduced several themes over here. Let me come back to the first one. You talk about 78 different specialties that you're now able to make available. As there is aging of the population, there's also a lot of growth in underlying conditions. The patients that you see in rural America, they're not only just far away from a distance perspective, but how do you see technology helping in managing people with multiple chronic conditions upstream rather than downstream?
Yeah, absolutely. Part of that allows us, again, to make sure that we extend more of those specialties to those individuals. And that's being able to provide care for them in their homes. That's being able to reach out to them in a critical access facility. Right now, we extend that care into 26 critical access facilities as well that provide them with a full complement of services. So if that individual is coming in for maybe a checkup with their primary care physician, they don't have to wait days, weeks, or months and then have to expend a lot of money and travel time to be able to receive that care for that specialist. Instead, we're able to do that real time. We're able to do that through the emergency medicine providers. We're able to do that through our family medicine providers as well too. And then in addition to that, we're also found ourselves in a unique situation as well, where we're able to access people in their home as well. And we know sometimes individuals prefer to be able to access that care there directly. One of the ways that we're seeing probably most transformative, and when you think about those comorbidities, we know well in this room that one of our very significant challenges that we face here in our country and really around the world is with respect to behavioral health. And we know very clearly the evidence is there to prove that that also has a compounding impact on some of the other healthcare related issues that they have. Virtual care has now allowed us to reach out to more people and to be able to do that in a real-time way. For instance, right now, 1 in 5 of every one of our behavioral health consults happens virtually. Because of the advancements from a technology perspective, we're able to do that through self-scheduling. These individuals do not need a referral. They do not have to work through another provider, but our patients are able to come directly to and to be able to schedule that encounter and to be able to do so real time. And we think that these are some of the most important ways that we can meet some of the most dire needs that we have right now in the country.
And you think with this remote care and interaction with the specialists, is there a growing trust? Are people feeling more comfortable with the technologies?
It is. You know, I always think it's, you know, one of the bits of misinformation that floats around, and it's
Yeah.
this misunderstanding that individuals living in rural America are somehow either not proficient or are somehow resistant to the advent of technology and the use of that. And for those of us who live in rural America and serve there, we know that that's not accurate. But these are communities, these are individuals who have openly welcomed and have utilized that. You think about some of the advancements that we've seen in the last few decades from an agricultural perspective, and the high levels of technology that are being used and implemented there. I mean, these are individuals who are hungry for it, they're proficient for it, their children are educated in this, and we don't run into that resistance. We really don't. We've actually seen that be received very well, both on the provider side as well as on the patient side.
Interesting. And coming back to your earlier statement, and you talked briefly about the workforce piece.
Yeah.
Now, coming with the AI solutions and technologies, how are you seeing in terms of retooling them from use of technologies itself? Are you seeing the workforce getting trained up in your system, and what
Yes.
kind of strategies are you using to do that?
Yeah, absolutely. We know this, that again, one of our challenges right now that we have in front of us is with respect to that workforce, in making sure that we have the workforce sufficient to be able to meet the ever-growing and changing needs of our patients, of our members, of the individuals within our communities. And I'll say right now at Sanford Health, across an incredibly dedicated workforce of about 55,000 individuals, today I have 3,000 openings. And so when you look at the communities that we serve, there are not 3,000 people out there waiting to come in and to start to do that work. But at the end of the day, we still have to continue to meet those needs and those demands. And so for us, it's how do we do more with the same number of individuals that we have? And how do we make sure we do it in a way that continues to deliver that joy of healthcare? To make sure that our individuals who are serving, our caregivers, are able to do what they want to. They're able to spend more time interacting with those patients. They're able to be a part of delivering that care, that comfort, and those cures. And so for us, it's training up that workforce. We've talked about the virtual care initiative that we have. That hub that we have right now is first and foremost being used to train up those clinicians of the future. Our physicians, our nurses, our medical technologists are training in these facilities. We talk about with our physicians, helping them to develop their website manner and understand what it means to be able to deliver care through a different modality, to be able to do that from a virtual perspective. We have actually incorporated that virtual training and AI training for our physicians in some of our graduate medical education programs. We're actually doing that right now in our residency programs for emergency medicine, in internal medicine, and psychiatry right now. And we'll continue to roll that out and add that to all of the other graduate medical education programs that we have at Sanford Health. In addition to that, it's working very closely with our nursing schools and our nursing programs to help build out some of the proficiency there as well. And then it comes to the talented caregivers and the work that they're doing today. We know right now that, again, another chief challenge we face is burnout.
Yes.
Our caregivers have been through so much. And my mother reminds me of this too. Just because we're now finally talking about it, which is good, I'm glad we are, healthcare didn't just all of a sudden become hard. Right? It's always been difficult. It's taken the best and the brightest to do that work. It's taken the most dedicated. It's physically taxing. It's mentally, it's emotionally taxing. And so how do we pull some of the burdens off of them that over the last several decades have just sort of been added to that? That backpack has gotten heavier for our caregivers. And we've seen with the opportunity now through using things like ambient listening for our clinicians, giving them the opportunity to get away from the keyboard, to be face-to-face with their patients, to spend more time connecting with them. We've been able to look at our patient satisfaction scores, and for those providers who are using the ambient listening, those patient satisfaction scores are continuing to come on the rise. When we talk to our providers and we ask them, what do you think? What are your thoughts about this? We had 100% of those who have started using that ambient listening in their clinics have told us that I do not want to see this taken away. We've had 88% of them say that it has a positive effect on their well-being and on just the way in which they feel when they leave the office. We've had a 90% satisfaction relative to avoiding physician burnout. And then it's the anecdotes. I had one physician tell me out of our Fargo market that said, "If you take it away from me, I will find a new job."
Is that right?
And we had, and so those, and they mean that.
Yeah.
And one of the other really positive feedbacks, probably one of our busiest by way of panel size family medicine physicians, said in the past decade, prior to using the ambient listening, he had not been able to go home and have dinner with his family one night. And after 1
Doesn't
month,
go and sit and work and finish.
that's right. And after 1 month of that ambient listening, he said he went home, had dinner with his family, and then was able to spend some time with his daughter afterwards, who had just got her driver's license. So he joked about, "I'm not sure that I wanted to. Maybe I was safer at the clinic," but was able to go out with his daughter and spend time driving. And it's those types of things that are really important. We ask so much of our people. We ask so much of our caregivers. And what I'm excited about is with these advancements that we're seeing right now with artificial intelligence, it's giving us a chance to be able to let them continue to do what they do, but to help roll back some of those burdens and help bring in more joy into those sites of care, which at the end of the day we know translate to better outcomes for our patients as well.
So your message to those in the room here or virtual listeners is, as they're running their delivery systems, is there is hope that there is adoption is happening.
Yes.
Technology tools and people are willing to learn and improve, because there's a lot of concern in the marketplace saying that are people ready for the new technologies?
Mm-hmm.
Will the adoption be fast enough because new tools are coming in? So how would you say to those people who are wondering to effect change, what kind of leadership skills would be needed to make sure that we are connecting with our workforce and helping them move up the chain in terms of the learning process and using the new technologies?
Yeah. I'll maybe use this example. And so in addition to the privilege I have to serve at Sanford Health, I have the privilege of being married to my wife of almost 21 years, and we have 5 beautiful children. And so a lot of my memories or stories that people have to endure revolve around my family. And so I'm taken back to thinking about driving in the minivan. And I don't think I've ever seen any of these movies actually with my own eyes, but I hear them playing in the background over and over again. And one of the movies a few years ago that my children just fell in love with was this movie called The Croods. And so I don't know if anybody's seen it. If you've got children, my kids' age, you know what I'm talking about. And it's this story about a prehistoric family. And the father, the patriarch, is so proud of the fact that he has kept his family alive. And he keeps his family alive with this mantra, which is never not be afraid. And he makes them chant that as they barely leave the cave to quickly grab food in the morning, and then they hide in the cave all day long. Well, eventually, as the movie rolls on, it is through the bravery of the eldest daughter who says, "I think there's more out there, and I want to see what's on the other side of the mountain." And as you get all the way to the end, of course, you find that being able to think outside the box, be able to think beyond the habits that you're in today, that allowed them to see the new world on the other side of the mountain. And I think that's analogous to where we're at in healthcare today. Just like the prehistoric family and the Croods, hiding in a cave doesn't work. That's not really called living. And I think sometimes we find ourselves tempted to think, you know, I'm not sure if this works. I know we've got a lot of challenges, but I'm too afraid to change, right? Because maybe it gets worse on the other side. And what I've said is where we're at right now, we don't have a choice. We can't hide in a cave any longer. We have to be able to step out. We have to be able to think differently. And I believe, again, our best way forward is going to be by partnering correctly inside and outside of industry to really leverage these advancements of technology. And I think very uniquely where we're at right now in healthcare is, and you don't have to look outside of this room to find it, but you can if you'd like, there's some challenges. It's tough.
Yes.
It is a really tough space out there. And it's tough everywhere around it. It's tough as patients, it's tough as members, it's tough as residents, it's difficult on the provider, on the coverage side. It's hard to be in the state legislatures. It's hard to be in DC right now. I mean, these are hard conversations that are taking place.
Right.
But at the center of it is still a person. And we all have the unique opportunity and the responsibility to do right by those patients. I think that because we are in such a challenged environment right now, that gives us the unique opportunity and the urgency to change what we're doing. At the end of the day, human nature, and I'm not clinical, so big caveat, I'm a recovering lawyer, but I'll trust the clinicians and the researchers in the room that would say, human nature tells us if we don't have to change, oftentimes we won't. And where we're at today, we are forced to change. And I think that that's a great opportunity at this inflection point. There we have the opportunity then now to lean into, I think, the most rapid and most incredible advances we've seen from a technological perspective, in the last several decades, and it's just continuing to pick up. And so it's a great opportunity for us to change how we do what we do, which is ensure that we're delivering world-class care to everybody.
So it's a leadership opportunity rather than a challenge, because a lot of people out there, just because of the issues that are surrounding AI, its use and ethics and everything else, are sort of feeling overwhelmed.
Yes.
But what we are hearing from you is that it's a leadership opportunity, once in a lifetime leadership opportunity.
Yes.
We are at a point in our nation's history and the world's history is that we have these new technologies coming in. Innovation in systems happen because of infusion of new technologies. Which brings me to the next question. The ultimate benefit will happen if people are able to take a step back and say, how do we rethink, redesign, re-engineer our operations, every aspect of it, not just operational piece, but as you've pointed out earlier, the financial part of it, the community part of it. So what are your thoughts relative to that aspect of rethinking and reimagining the healthcare system?
Yeah.
Is it even possible?
It's possible. It has to be. It has to be. We don't have a choice. The current state is not sustainable. It's going to change. So we either get to be a part of shaping that change, or that change just happens to us. And I believe that whether you're on the policy side, whether you're on the coverage side, whether you're on the care side, whether you're on the research side, the innovation side, the device side of the house, at the end of the day, everybody wants to be successful. At the end of the day, we want to do right and to do better for others. But there is no one single aspect of that continuum that in and of itself is going to be able to make this happen. In order for those who are on the cutting edge of technology, that are doing the incredible things that we're all experiencing real time from a AI perspective and otherwise through this digital transformation, it's no good unless it's applied, right? They need to be able to partner within industry to be able to bring to life the full potential. At the same time, we can't transform how we deliver care. We can't transform the way in which we provide coverage for members and for patients without their help. We have some of the most talented people in healthcare, but it's a different skill set than you're going to find with some of these incredible startups, great institutions like we're experiencing today and that we're here with here. We all have to be able to work together, and we have to work together with our policymakers and leaders and our elected officials. And I would say right now, as we sit here today, we are very fortunate in this part of the country that I very firmly believe that our elected officials do understand the critical importance of healthcare. We just heard Governor Walz at the start here. He understands that. Specifically to rural healthcare, he knows rural. He's lived in some very small communities. We've got Leader Thune in the Senate that's from a town of 300 people.
Right.
We've got Senators Klobuchar and Senator Smith here in Minnesota, who I know are also staunch supporters of that, and I think Senator Klobuchar is going to be with you later today. It's working together in coordination with all of these individuals to leverage this in a right way. You talked a little bit about what it's going to take from a regulatory perspective. And I think about Senator Rounds, who is leading bipartisan caucus on how do we use AI, how do we put the right guardrails around this. And one thing I always want, and I think that's great work, one thing I always remind people is that one of the things that we're blessed with within healthcare is that our caregivers, they already start and end with the proposition that they're not going to do harm. They're going to do right by their patients. And so I don't care whether it's using a stethoscope or whether it's using the most advanced levels of generative AI, they want to do it in a safe way. They are committed to making sure that the care they deliver is done in the right way. And so I advocate for a light touch on that regulation that creates a positive environment and a great ecosystem to not stifle innovation, allow industry to partner with the startup organizations, allow us to partner with academia to make sure that we use the best and the brightest to drive the right research, to drive the right innovation, and then work to apply it. And it's no different in this industry than it is any other. We've got to be able to fail fast. We are not always going to be right, but I believe that if you trust the right people in this process, that they're going to do right. We're going to do it in the right way, and we're going to make sure that it's safe, that it's transparent. We have, like many organizations out there, we've got a multifactorial governance that we have within our organization that brings our bioethicists, that brings our clinicians, that brings our lawyers, our physicians to the room to make sure that we're making the right decisions for our patients. And I believe that that's the right environment where we can really begin to thrive and to really harness the full power and the full impact of artificial intelligence.
One of the things that you just pointed out was also all aspects of delivery of care being
Yes.
Being seen differently or reimagined. You've been well known in the marketplace for your collaborative approach. You're always seeking partners, strategic partners. Tell us a little about your regional health alliances, how you're orchestrating the marketplace to better serve the people from a collaboration and partnership perspective. Who are you partnering with?
Yeah, certainly. No, I appreciate that. And as I stated before, I mean, Sanford Health is really the result of great organizations that have come together over the last 100 years. And it's hospitals, it's health systems, it's physicians, it's academics, it's looking with research. All of those have come together to create this organization that, again, is coalesced around that mission to care, comfort, and cure, and a vision to be the premier rural health system in the United States, to make sure that we make good on the promises I've talked about today. And as we've done that, we've been able to align ourselves strategically with great organizations that are mission-driven, that are focused on making sure that the person is always at the center of every decision that we make. Even this last year, we had the opportunity to come together with Marshfield Clinic Health System out of Wisconsin, the Upper Peninsula of Michigan. Over in western South Dakota, we had an opportunity to join up with the Black Hills Orthopedic and Spine Center and the Surgical Hospital. And it's finding these others who are committed to do that work to say that on our own, we don't think that we can continue to further the mission. We've got inflationary costs. We've got a lot of the pressures we've talked about here. And how do we do more with the same amount? And so for us, we look at the virtual care initiative that would not have been possible but for the generous philanthropy of Mr. Sanford, our donor, who gave us $350 million. $350 million to start this initiative. And the thing about a lot of these investments, it's a one-time fixed cost, right? And that didn't matter whether we were going to serve 1 million patients, 2 million, or 2.5 million patients. And so as we've been able to partner with these other organizations, we're spreading those capabilities out now across 2.5 million patients. And we can continue to do that because we're not limited by the scope. And so it's looking at working with those organizations. And at the end of the day, as a not-for-profit health system, our constituents, our stakeholders are our people, it's our communities, it's our patients. And so it's looking back, a little over a decade ago, we had the privilege of coming together with North Country Health in Bemidji, Minnesota. And when we came into that community, we had an opportunity to address some needs. Over the course of the last few years, we've been able to invest over $100 million of capital in that community. We've been able to start a behavioral crisis center, the first pediatric empath center in the state of Minnesota. We've been able to open up vascular and cardiac, which was in 2013 when we opened up those services. It was the only cardiac care in northern Minnesota. And it's allowing us to meet the needs of those patients. We have advanced cancer care now in those communities, and it gives us the opportunity and the privilege to serve more and to serve those communities. We did similar in Worthington, Minnesota. We had a chance to bring advanced cancer care to that community so these patients don't have to drive 100 to 110 miles away to be able to get that care. And as we do that, and as we join in with organizations, we're able to bring more providers to those communities. We've doubled the number of providers in each one of those communities since the time that we came together and merged. But now with the advent of these advancements in technology, it's incredible to see that what we were able to do in 5 and 10 years, we're now doing in 12 months and less in being able to expand these services. Like I said, here in the last few years, we've been able to add 78 specialties that we provide through virtual care. Those now flood into every single one of those communities. And so as proud as I am of the history, I'm more excited about what the future holds, because I believe that And if I use the example of Bismarck, North Dakota, in the last decade, we added 400 new providers to that community. Well, now we're going to be able to do that through virtual in a matter of months. And that's so important when it comes to meeting those incredible access gaps that we have right now.
So this is really exciting what you're talking about, because I can see the model that you're building, not only serving the communities in the 5 states, but also something that can be replicated nationwide.
Correct.
Rural care is rural care. There's a lot of commonality there. And I'll come back to that question in a moment, but science and research. University of Minnesota has just a phenomenal collection of scientists and researchers. A lot of them have worked in the area of healthcare,
Yes.
Looking for new cures or new ways of delivering care. So how do you see in your setup, what are some of the strategies you're using for powering up science and research establishment? Are you working with university systems, or how are you pursuing that end goal?
Yeah, we believe that like all aspects of care and everything that we're talking about here, to create a healthier country, we've got to partner with all institutions around this country. And so for us at Sanford Health, we're thrilled and proud to be able to provide, today we have over 1,500 active clinical trials across our system. And those are with us because we've partnered both internally with our own internal research organization. We've partnered with the academic institutions that we're around, and we are heavily reliant upon work that they do. Great work that's happening here at the University of Minnesota. Partnering with those academic institutions and those researchers to say, how do we do better? How do we continue to innovate and push and advance the work that we're doing each and every day? And that's a critical part of what we do. Those of us who are at the points of care know and understand that when you think of clinical trials, that's more opportunities for more people to be cured. And that's critically important. You know, we're proud of the statistic that across the country, about 3% of cancer patients are actively on a clinical trial. At Sanford Health, it's greater than 10%, and that's because of our collaborative opportunity to work together with our other institutions, to work together with outside organizations, and then critically important, it's our care teams. It's our physicians that say we're going to work together to make sure that we make ourselves an attractive site to be able to deliver those clinical trials, because our patients deserve it.
So you put a lot of emphasis in your career, in your work, on collaboration and moving forward with new ideas and new innovative approaches. So if you were to summarize in a minute, what would you say is the vision for the future, not just for Sanford Health? What would you say is the vision that we need to think about for the future of the country in the healthcare arena?
So I started with articulating Sanford Health's chief challenges around access, quality, and sustainability. But I don't believe that those are unique to our organization. I also don't believe that those are unique to rural healthcare. I believe that those are some of the 3 biggest challenges that we have in front of us in providing better care for a healthier country, whether you're the most densely populated urban communities or whether you're the most sparsely geographically isolated rural communities. At the end of the day, we're all trying to address these issues in the same way. And I think in order to be able to do that, and my advice would be that we have to partner outside. When it comes to this exact topic we're talking about, how do we usher in and make the best use of this digital transformation of artificial intelligence? It's not on our own. I'm not going to be able to hire that talent into our organization. Instead, I need to partner with academia, I need to partner with industry to find the best and the brightest who have the ability to unlock the potential in front of us from artificial intelligence, and then bring that in. Because on the care side and on the coverage side, what we bring to the table is that real life application, that expertise about how do we address this issue. And if we're willing to partner with industry and we're willing to partner with our academic institutions, I believe by coming together to do that, we can help appropriately educate in a solution-oriented way our policymakers that allow us to be able to do the things that we need to do in the future. And that's maybe my biggest message is we have to be a part of the solution moving forward. And that's our best way to do it is in partnership with one another.
Now let me see if there are any questions coming in from either virtual registrants or otherwise. Anybody else that may have a question or two? Bill had agreed to.
We have some mic runners if people have questions.
You sound like the guy from the Croods that bring the people out of the cave.
I don't know if that's good or bad.
It is a good thing. It is a good thing. I'm so impressed with how you described it. So, coming from academic standpoint, I work with Sanford Health. He's our partner on the UND School of Medicine and Health Sciences. Something that concerns me as we embark into this is healthcare AI literacy, and what are we doing in terms of generating future providers that are bought into utilizing AI. What do we do for AI into medical education? Can you throw some light on that?
Yeah, thank you for the question, and most importantly, thank you for what you do. You know, it really is, and it's part of what I referenced earlier. And again, it's going to take everybody at every level partnering at this. But we have to get very intentional about incorporating the use of artificial intelligence in our education system, starting at the youngest ages all the way through graduate school, through our medical school, through our nursing schools, and then through our residency and our training programs. You know, I referenced this last year, we've been able to start implementing the use of AI in training for our residents in emergency medicine, internal medicine, and in psychiatry. That's not enough though. We've got to be able to move, we've got to be able to move faster. And in order to do that, it's going to take a collective effort by our governing bodies. It's also going to take a collective effort by our sponsoring institutions to say we have to do this. If we really want to be able to capitalize on the incredible opportunities in front of us, then we've got to commit to investing in that way. And so I believe that there are many other organizations like Sanford Health that see it that same way and believe that they want to do that. And then I think it's bringing industry along with us to say, partner with us, help us do that. And I think if we do it in that way, we can see a situation where all ships rise. And at the end of the day, the benefit falls to our patients and to our people.
I saw a question over there somewhere.
Hello. Oh, question about actual care delivery. It seems like the rural communities stand to really benefit from technology, maybe more than any other setting. How do you see AI impacting medical decision making in your system?
Yeah, great question. And it does, but I'm always careful because I never want to make sure that somebody misinterprets when I talk about the incredible opportunities that we have in rural, because it isn't just exclusive to rural. I think that the opportunity for advancement in closing access gaps and improving quality is very much the same in our urban communities as well. But it's one of the only ways that we're going to close this gap in rural. I can promise that. And I would say this, you know, to the question around decision making and what does that look like? At least the way that we've looked at it internally within our organization, and I think I've said this before publicly and would continue to advocate for that, leveraging it as, again, one of our most powerful tools to aid our clinicians, our physicians in making those decisions, you know, sort of becoming kind of a popular sort of way to say it, sort of the physician, the provider in the loop, I do think is critically important, but not just for the application and how you make the decisions, but also how we train these models and how we think about what it looks like in real life application, making sure that our physicians, our clinicians, our nurses are a part of that work to inform what does that look like in reality in an application. I believe it's a way that we'll be able to go faster by going a little bit slower up front, making sure that we're careful about what that looks like. And the other part of that is at the end of the day, technology won't replace that sacred relationship that exists between that provider and between the patient. They trust them. And so by leveraging that relationship and using it in the right way, I believe that we can tear down some of that mistrust and some of the mystery on the provider side as well as on the patient side, because we have to continue to be very transparent in how we use this, when we use it, and the ways that we're doing it, and to make sure that our workforce understands this is not a way to eliminate jobs. Instead, one, organizations like ours, it's a way to fill a big gap that we have, but then importantly, it's a way to elevate everybody to make sure that they're not just working at the top of their license, but they're working at that top of, you know, sort of their fulfillment of joy and mission. They're doing the most critical, most, you know, highest and best use of their skills and ability.
So when you think about implementation of AI, do you guys have any key performance indicator that you are really focused on, you know, addressing, or any kind of current key performance indicator that you are looking to address with, you know, implementation of AI?
Yeah, so I'll say it this way, and we've talked a lot about that within our organization. And where we've landed at is whether it's being aided by or any way assisted or leveraging artificial intelligence, or whether it's not, we want to hold it in those results to the same standards. And so when we have our quality indicators across the organization, our expectation is that whether it's an application where we're leveraging the advancements of new technology, new digital, new artificial intelligence, or whether we're not, it's the same standard. And so if it's working, then it better be at or better than that standard. We hold it to the same financial as well too, the same patient satisfaction and the same employee net promoter scores as well. And where we've been really excited is we've actually seen some of those indicators be higher. I referenced earlier where we've leveraged and deployed ambient listening, we've seen our patient satisfaction scores increase. We've seen our employee net promoter scores increase as well too, and that's resulted in better outcomes as well for our patients. And so it's one of the reasons I get really excited, and want to be able to scale that even faster and farther. But we think for us, it's important to make sure that the ultimate standard, because at the end of that decision as a patient, that we don't allow that to be held to any different standard.
Well, thank you so much. I think we're running out of time, I'm told. There are a lot more questions. Why don't you all please submit your questions, and we'll make sure that we will circle back with Bill and get you some answers to your questions. I think we need to take a coffee break. Bill, you've been most gracious. You've given us enormous amount of time this morning. We appreciate your being here today.
Thank you.
I know you would like to take more questions, but we want to keep the trains moving.
Wonderful.
These guys are looking at me and saying, let's go.
Well, again, thank you so much. It's been a privilege to be a part of the conversation. Thank you for what you're doing. Thank you as well for the work that you're doing here at the University of Minnesota. In order for this to work, we have to be all working in concert. We have to continue to make sure we leverage the best and the brightest in the industry, and this is how we're able to do it. So thank you.
Thank you all. Round of applause. Thank you so much.
Thank you so much.
Appreciate it.
Thank you.